Good morning, listeners and followers, and welcome back to my channel. Dr. Sean here. The reason for this video is just to share some data on insulin resistance and type 2 diabetes. Now, for those who are affected by or have family members or know somebody who is affected by insulin resistance or type 2 diabetes, you may know the numbers. This is just general numbers I took as part of my research. For those that are not aware, maybe you'll find it helpful. It will be a bit of maybe like a shock and awe for some people. It was certainly for me. And as you know from my previous video, I've been diagnosed with prediabetes and I did not see that coming. But on the positive side, I am doing a lot to change that around, and I have been busy with implementing quite a few changes in my life over the last 4 weeks, and I will do a video on some of those experiences just for the sake of awareness and education. So in this particular video, it won't be a long video, just a few slides. I'm just going to run through some slides on some data I pulled off the internet on insulin resistance and type 2 diabetes. For those that watched my videos, thank you so much for watching. For those that liked it, subscribed, I really appreciate it. For those that haven't, please have a look at it. I will link the two videos at the end of this talk, so you can actually have easy access to it. So let's start. It's estimated that up to 25% of the global population may have insulin resistance. I do not have specific numbers on that. I couldn't find. I will look deeper into it. And as insulin resistance leads to prediabetes and diabetes, type 2 diabetes, that is a really scary number. And the number has been increasing over the last 2 decades, the last 20 years. Okay, metabolic syndrome is also increasing, and that's not surprising. There is a link between people with metabolic syndrome and insulin resistance, insulin sensitivity, type 2 diabetes, and the factors like obesity and what leads into it, as well as cardiovascular disease. So in my deep dive video, I talk about metabolic syndrome. So check that out in my other video. So they say globally, the prevalence of insulin resistance varies, but it is rising due to increasing rates of obesity and sedentary lifestyles, i.e. not exercising, not moving, not keeping fit, and also poor diet. So as someone who worked as an academic and who's done academic research and basic research, I do like a graph, and I found this in a published paper on the global research trends on the links between insulin resistance and obesity. And it's interesting, and this is only up until 2021, but for the last 20 years up to 2021, just before the pandemic, from 2002, there has been over 6,600 publications just on insulin resistance and obesity. Just shy of 5,800 has been original journal articles. There's been near almost 500 review articles on these two topics, and obviously 109 letters to the editor. So you can see since 2002 there has been an increase in research being done in insulin resistance and obesity. The numbers since 2012 has basically stabilized. I'd be interested to see if I can find stats on 2022 till 2024, whether that trend is continuing or whether it's dropped off or increased. Just some interesting stats from the United States. This is data from 2018, and it's from the CDC, the Center of Disease Control in the US. Prediabetes, which I'm now in that camp, 88 million are adults in the US, so that's more than 1 in 3 are living with prediabetes at that rate. And I bet you, if you fast forward 6 years to 2024, that number would have increased. The most scary thing about all of this is that 84% of those individuals did not know they had prediabetes. And that's the same for me. I wasn't aware that I was pre-diabetic. There may have been signs and symptoms, but people don't really connect the dots when it's an odd symptom here, an odd symptom there. So scary. Type 2 diabetes is now referred to an epidemic due to its rapidly increasing prevalence worldwide. And the type 2 diabetes rates are rising and has risen over the last few decades. And like I said before, it can be contributed to poor diet, lack of physical activity, and increasing rates of obesity. And it goes without saying that it is a public health concern and it needs addressing at the policy level and also at an individual level where people need to take responsibility and ownership for their own health. And this is part of the reason why I've done the video, to talk about my experience, to talk about my diagnosis, to bring awareness, to bring it to the forefront, to create a discussion as well as the awareness, and also some sort of education for those who are unaware. And listen, what I'm doing is not, especially this particular video, is not a scare tactic. I'm not trying to scare you people to death about this and overhype it or be unrealistic about what diabetes is all about and how it may affect people. I'm not scaremongering. It's a fact. The statistics are out there and it has been getting worse. Every 5 to 10 years, the numbers just seems to go up and up and up. So it is something that we need to take seriously, and this is part of why I'm doing what I'm doing. This slide is just showing a global picture of diabetes prevalence. So the percentage of the population between the ages of 20 years old and 79, and where the incidence of diabetes is the highest, with the darker reds up until the lightest. So you can see in some countries like Egypt and parts of the Middle East, Mexico, South Africa, you could see what the incidence rates is. So they say that over 537 million adults between the ages of 20 and 79 globally are currently living with diabetes. And that accounts for about 10.5% of the population in that age range. So this just gives you a nice snapshot of what the status is regarding known diagnosed diabetes. This is known numbers. Just zooming in on the global picture. So snapshot numbers, 51 million with type 2 diabetes in North America and the Caribbean, 24 million across Africa, Southeast Asia, 90 million, Western Pacific, 206 million, and the Middle East and North Africa, 73, with Europe in 61 million. Those are the numbers as at 2021, taken from the International Diabetes Federation. And that website, you can easily go there and find lots more information if you want to find out more. As I said before, 537 million adults are living with diabetes worldwide. It is projected that that number will go up to 783 million by the year 2045. That's more than 200 million over the next 20 years. So we need to do something about it. And as I said when I did my deep dive and I talked about how insulin resistance and prediabetes hit certain ethnicities and what the effect is for some socioeconomic groups within certain societies, I'm not surprised that this statistic says diabetes hits the poorest the hardest. So 3 in 4 people with diabetes live in low and middle income countries. Even more scary, one person dies of diabetes every 5 seconds, and those that don't die will live with disability and a very low and poor quality of life. Let's look at some more numbers. So 6.7 million deaths in 2021, 1 in every 5 seconds. I'm probably going to research and find out what the number is, if there's more updated information up to maybe last year or this year. What's the cost? So they estimate that 966 billion US dollars, and we're nearing $1 trillion US dollars, has been spent in health expenditure on patients and people with diabetes. And that's a 316 increase over the last 15 years. And also 541 million adults have impaired glucose tolerance, and that is insulin resistance and prediabetes, if I'm correct. So we're looking at currently over 500 million people with diagnosed diabetes, and also another 541 million of those who are not classed as diabetic yet, but in the early stages of insulin resistance or advanced stages or pre-diabetic. And that puts them at a much higher risk of developing type 2 diabetes. This slide is just for those who are interested in knowing what the actual numbers are for some countries. There is a website that shares a lot more information about the top 300 countries, from the worst all the way down to, I think, 280 or 300. So Pakistan, French Polynesia, Kuwait, Nauru, New Caledonia, a couple of islands, Mauritius, and closing out the top 10 is Egypt. So the percentages is quite high, from 31% all the way down to number 10 is 21%. If you look at where the United States fits in, 11% of the population with type 2 diabetes, and the United Kingdom with 6%. And there's a lot of countries in between on that. So I just wanted to share that one just as a snapshot on where some countries lie within this epidemic. Okay, that's a wrap, folks. I just wanted to share this number of stats on insulin resistance and type 2 diabetes. If you haven't watched my other videos, the 2 videos on my blood results are linked above, so you can have a look at them. And I'd just like to thank everyone who has watched my video or parts of my video. Thank you for those who liked and subscribed. And if you haven't done so, please do. It helps support my channel, and I'll see you in the next video.